According to the Samaritans, Mr. Joe Ferns, he said financial difficulty can contribute to the breakdown of even the strongest relationships with friends and family. People may rely more heavily on alcohol and drugs as a coping mechanism, and it is well established that excessive alcohol consumption and drug misuse increase suicide risk. Research undertaken on behalf of the Samaritans shows that the unemployed are 2 or 3 times more likely to die by suicide than people in jobs. Unemployed men are more at risk than unemployed women. Other studies indicate that unemployment can often lead to anxiety, depression, low self-esteem, and feelings of hopelessness, all of which point to the reality that a number of these people will need our services if their lives are to be saved. It is also sadly a reality that suicides are on the increase again, with 460 suicides recorded for 2007. That's the last full year that we have figures for, and that was up 51 over the 2006 figure of 409. The latest report from the Inspector of Mental Health Services has identified that substandard accommodation and understaffing are still a feature of many of our psychiatric services in 2008. I am calling on the Minister to increase the level of funding to the psychiatric and intellectual disability services. We know that mental health problems cost the economy more than $3 billion in 2006, as the Mental Health Commission, and no doubt in today's climate the cost for 2009 will rise rapidly as unemployment levels grow. It makes sense both from a health and economic perspective to spend money on mental health. Unfortunately, the opposite is the case. It is not acceptable that when our services are creaking at the seams, that resources for our services are being cut. We need resources to be able to respond to the crisis that has befallen our country, and we need to have somebody responsible and in charge. In this regard, I am also calling on the Minister to appoint a National Mental Health Services Directorate as recommended in a Vision for Change, and that's also been supported by Amnesty yesterday, as you've heard. We need proper and appropriate community development to enable us to respond to the needs of a society in serious distress. I am calling on the Minister to instruct the HSE to respond to the demands of our General Secretary Des Kavanagh that psychiatric and intellectual disability nurses are made an integral part of every community care team in their respective areas. Despite his Trojan works over the last 2 years, little progress has been made. Other services have been identified in Vision for Change, such as outreach teams, crisis intervention teams, must also be put in place immediately and in every service. Call centres and drop-in centres need to be provided in the community. Suicide crisis liaison nurses must be replaced where vacancies exist, and they need to be appointed to the areas that do not have them. We hear a lot of rhetoric about the need to protect frontline services, but yet they are the first to suffer. The most recent cost containment measures from the Department of Finance clearly target frontline services with their diktat of non-renewal of temporary contracts. This is going to hit the most vulnerable of staff, and since they are most likely to be the people delivering the service directly to the patient will suffer most of all. I wish to refer to a report in the West Australian newspaper regarding Mr. Hames, Minister for Health in Western Australia, who the report states has written to Western Australian nurses telling them to complain to their bosses if their hours are cut in a way that affects patient care. This was, according to the paper, his latest attempt to deflect criticism that frontline health services are being hurt by budget cuts. He stated that frontline services should not be affected and encouraged nurses to report any breaches to their supervisors. Our minister does not seem to have the same concerns. Her response, could we get one, is likely to be a lecture about economic stringencies. We have heard this speech on a couple of occasions. Criticisms of the minister are pointless. Unlike the Australian minister, she is immune to them. She is a minister without a party and without any mandate from the people. Her politics and policies are, like her party, redundant. Does she care about mental health? I fear not. As for the HSE and Professor Drum, this organisation is rotten to the core. It does not appear to care one whit for frontline mental health services. Again, do not just take our word for it. The Irish Mental Health Coalition, in its document, late for an important date, was published to coincide with the 3rd anniversary of the introduction of Vision for Change, stated, that the progress of implementation remains practically non-existent, with almost none of the targets for the end of 2008 having been met by the HSE. Mr. John Saunders, Chairman of the Irish Mental Health Coalition, stated, "When a vision for change was published in January 2006, it was to be the blueprint for a radical new approach to a newly prioritised mental health system. However, there has been a lack of government action to match rhetoric. Progress in implementing policy outlined in a vision for change has been slow and lacking transparency. The result is that people using services, their families and carers are struggling to access services which meet the most basic standards laid down for mental health services. Demands on services are increasing, with over 20,000 admissions to inpatient mental health units and hospitals in 2007, compared to, I think it's about 500 less than that in 2006. It's the first year-on-year increase since the mid-80s. The Vision for Change document has come under considerable criticism in the past year, with the HSE confirming last June that only about half of the finances set aside for the reform process have been used as planned. By last summer, an estimated 24 million of the 51.2 allocated to the reforms had not been spent in mental health, with a significant proportion diverted to other areas of the health budget. We wrote to the Minister on this and received the typical civil servant response. We might postulate as to where this money went. An investigation carried out by the Irish Independent last October and based on information that they sourced through Freedom of Information uncovered a few interesting facts. The HSE paid 45.9 million to private advisors over a 3-year period. A breakdown revealed individual payments to hand-picked advisors in Mr. Drum's kitchen cabinet. Miss Linnett, a performance management advisor, was paid €637,274 between 2005 and 2007. Mr. Anderson, a communications consultant, was paid 545,000 plus a few more euro in the same period, and at a time when the HSE already had a fully staffed media relations office. Both of these are on 5-year contracts and are contracted to work 135 days a year. Nice work if you can get it. Miss Maura McGrath of McGrath Associates, a human resource consultant, was paid €606,887 in the 2-year period 06 and 07. Their contract continues to run despite the appointment of Mr. Sean McGrath as Director of Human Resources in May 2008. Sean Maguire, who was hired to advise on primary care and GP issues, received $379,000 and a little bit of change before he left to go back to the private sector in 06, and they tell us there is no money to be earned in the private sector. This at a time when former Mayor and City Councillor in Galway, Councillor Cott Connolly, described as deplorable and scandalous the HSE West's decision to stop providing lunches to 60 clients attending a day psychiatric hospital in Ballybean. Councillor Connolly told a meeting of the Regional Health Forum West at Merlin Park that this was a most miserly cut, which affected the most vulnerable. This cut came into effect in early September 2008 and meant that lunches, sandwiches are no longer being supplied to the 60 clients who use the facility. The meeting was told that for most of the service users it was their main meal of the day. A number came from hostels and depended on this lunch. The facility is not close to restaurants or food outlets, so there are no facilities locally for clients to obtain food. The PNA made substantial representations on this issue on behalf of the clients before Councillor Connolly made her representations. It is heartening to see some politicians have a conscience